My name is Bob Malizzo. This is my wife, Barbara.
Hello.
And we were victims of a hospital error. I want to start out by telling you something about my daughter, who obviously passed away due to this hospital error. What happened to her started in 2007. We found that my daughter had a polycystic liver, and it was creating a lot of problems for her. They did the first surgery, which went pretty well, but she woke up in the middle of the procedure, and they sedated her some more. We got through the first surgery. About 2 weeks later, there was a reoccurrence of the problem that she had, and they found that the bypass tube was blocked. So we scheduled the surgery. They operated on her the following day. Prior to the operation, we were waiting in an area by the room where they were going to do the procedure. And an intern came up to her because my daughter had expressed concern about waking up middle of the procedure. And when we originally discussed it, we thought it would be best for her to have an anesthesiologist there. The surgery was delayed for a few hours. We're in this waiting area, and an intern came up to her and said, do you want to wait for an anesthesiologist? It's going to be another couple hours. And she says, well, I don't know. I woke up the last time. And he said to her, don't worry, we'll sedate you. You won't wake up. And he was correct. She didn't wake up. We're in a waiting area when the surgeon came out and asked us to come into another room. And as we entered the room, he said, everything went terribly wrong. Your daughter had a heart attack. Well, we're working on her to bring her back. Bring her back? What are you talking about? He said, I have to go, and he went back into the room. Maybe 15 minutes later, we saw them wheeling my daughter out, and they said they were bringing her up to ICU. After a few days, my daughter was on a ventilator. There was really basically no response from her. A Dr. McDonald and a Dr. Schwartz, Dr. McDonald's associate, Nikki, and a Dr. Mayer asked if they could have a conference with us. And they said, we think that we may have committed some errors in your daughter's procedure. Dr. McDonald says, I don't know all the facts yet, but I'm investigating, and I will be back in a couple days to inform you what transpired. About 2 days later, Dr. McDonald and the staff met with us again, and he said, it was our fault. Your daughter's in here because of us. We made a lot of mistakes, and hopefully your daughter will recover, but the likelihood is that she won't. And we apologize for what we did. Obviously, we were angry. You let us down. Dr. McDonald said, I know we did, and it's my fault. Well, it wasn't Dr. McDonald's fault. We all know that. There was a number of errors that were committed on my daughter, including the emergency response team who trusted a monitor and no one used their stethoscope to see if her heart was beating. If they did and performed CPR, she'd probably be alive today. So we spoke with Dr. McDonald more, and we said, look, we don't want this to go in vain. What happened to my daughter, or our daughter, should not happen to anyone. And what can we do to help prevent this from happening ever again? So Dr. McDonald said, I will let you know, but I do have some ideas, and I could assure you we're going to change our procedures.
Well, when Dr. McDonald met with us about a year later, he asked if we would like to have a seat on the safety board committee, and it would be a lifetime seat.
But because of their honesty, it's created an atmosphere of trust. And I recommend this hospital to my friends or anyone that is concerned about their illness. Thank you for allowing us to speak.